as a medical doctor whose work focuses on understanding communities and the different health outcomes for different communities, I was really intrigued about these factors. And so when I started to do research and that kind of thing, it was really important to me to understand the health harms that are caused by everyday racism, whether they're, minor insults or slights, or the bigger piece, which is, barriers and lack of opportunities, whether it's opportunities for advancement or it's just an opportunity for a job. In North America, so in the United States and in Canada, you're more likely to be denied these opportunities if you're a Black person. And even if you get them, you might not have the same outcomes. So for instance, in Canada, a racialized person earns 81.4 cents for every dollar a white Canadian earns. And this is same education, like you control for immigration, everything else, race matters. For a Black person, it's 76 cents, right? For every dollar a white Canadian would make. So when I go into spaces and I talk about what are the health impacts of that, right? When you can't necessarily afford to feed your family or you're working 2 jobs to make the same income. So that can have that can really affect somebody's mental health or physical health. Now, when I give that to an audience, right, some people are like, wow, I never knew that before. But for some people, it's their lived experience. Even if they didn't know the numbers, they saw it in their neighborhoods. They saw it in the way they grew up, just like I did. And so students would come up to me and say, okay, Dr. Norum, Dr.O, I understand that racism affects health, but now I'm a student. I'm coming from, a particular background. I'm the first person in my family to go to university, and I have this dream of, bringing health and doing good things. But based on the information you're telling me, even if I get an education, even if I have a higher income, I'm going to face barriers because I'm Black, or I'm going to face barriers because I'm South Asian or because I'm Indigenous. How do I stay well knowing that? Because the world is not going to change immediately. And so this podcast was really a way of trying to answer that. Like, where students young people basically have been asking me, how do I stay well in a racialized world?